of Commissioners work session. We are pleased that we have today Deloitte with us to talk to us about where we are with our American Rescue Plan Act investment strategy. And Jimmy, I don't know if you'll be kicking us off before we go to Deloitte. Please feel free to approach.
Good afternoon, Chairwoman, Commissioners, County Manager, County Attorney. We're at a good spot. It has been what seems like forever since we engaged Deloitte, but it is not. There has been, the feet of the ducks have been ferociously paddling under the water while it looks like the duck is just swimming along on top of the water. I would be remiss if I did not first mention our Cobb County team that has worked with us since day one. Ross Cavett has helped us with communications, Debbie Blair from the legal side, Bill Volkman from the financial side, and then Shannon Woody has, as always, kept us all going straight. Of course, the objective that we have, are you gonna flip me, Brad? The objective since day one has been to develop an investment strategy which will guide how the funds are allocated. It is important that we know the buckets that the money would go into before we can even develop these specific programs that will impact our communities. The process has been that we gathered a broad set of community perspectives through various methods, from a survey to focus groups to one-on-one interviews to an ideation lab to engage our community representatives. Brad, go ahead. This is who all's been involved. Of course, the board and the county residents, the county nonprofits have been very involved in this process because we do see that they have a process put in place that might help us in the long run distribute some of these funds. Various county departments and partner agencies, county businesses, small businesses and large, and then as well county management. We started in October. We have held Thursday morning meetings every Thursday except I think Christmas since that time to make sure that we're in touch with what Deloitte is doing. They have a great team, but it was important for us to meet with them weekly to get our process going. We have engaged the stakeholders all the way up through March. We analyzed and categorized the initial investments, and currently we're at the finalization of the investment strategy right here at the end of March. Once this is completed, we will come back to you with a process by which we will start allocating the individual projects. But at this time, I'm going to introduce John Alessandro with Deloitte and let him lead us through more of the guts of the presentation.
Thank you, Jimmy. So yes, John Alessandro with Deloitte. So the first thing I wanted to do was level set everyone back to ARPA. So what is ARPA? So $350 billion was given to the states and locals. Of that, Georgia got $8.4 billion, and the counties themselves got about $2.1 billion. And as we know, Cobb County got $147 million. So that money focuses on a number of initiatives, which we'll go through on the next slide. Certain things I want to point out, the deadlines, we have to obligate it by the end of 2024, and the money has to be spent by the end of 2026. The county got their first tranche of money, half of the money, last May, and the second tranche is due to come this May. And then the allocation formula, so how did they get to the $147 million? That was based on a number of things, mostly population, but also unemployment and poverty rates. So you'll notice different counties got different amounts, again, based on a formulaic approach done by the federal government. So again, what's eligible under ARPA? So this is something that we obviously focused on with the county as we move forward here. So supporting public health expenditures, obviously the primary area. Also investing in water, sewer, broadband infrastructure, very important. Premium pay for essential workers. So, you know, anybody from first responders to grocery store workers to sanitation, those who are on the front lines during COVID, providing them with some premium pay. Replacing any lost public sector revenues, any revenue that the county may have lost due to COVID is also possible through ARPA. And then last is the broadest category, is addressing negative impacts due to the pandemic. So anything, you know, that the community was hit hardest with based on COVID can be addressed, you know, again, through the use of ARPA funds. So the county is expected to, you know, follow this guidance as we spend the ARPA dollars within these eligible areas, and that's, again, what we've all focused on as we move forward here. So let me walk you a little bit through the process that we have engaged with the county on to get to where we are today. So first, engagement. So as Jimmy mentioned, there was a broad stakeholder engagement done, and we'll go through that in a little detail here shortly. We also analyzed the information that was collected from all these stakeholders. So a lot of ideas, a lot of topics, areas of need that were identified throughout the county. So we looked at all those areas, which are the ones that came to the forefront, which are the ones that were mentioned the most, and we went through a lot of those to figure out where do we want to focus our dollars. Then we prioritized. So of all those lists of items, we prioritized them. Again, based on the needs and based on everybody's input. So where do we think that money should be spent? Obviously, limited pool of dollars, and we want to focus it on the right things. So where we are today is trying to finalize that initial prioritization, that initial allocation. You all will obviously vote on that going forward, and then from that we'll start selecting projects, and those projects will go through, again, another process of voting and things of that nature to get to the front. But right now we're at the finalization approach, again, of the investment strategy. Where should we allocate those dollars? So let me go through a little bit on the stakeholder engagement. So we did a community needs survey that was published to any citizen in the county could have participated. We got 2,651 responses, which we were very happy with, from all across all of the county, every zip code. We also did one-on-one interviews with 8 of our county leaders. Listening sessions, so we held listening sessions to hear what people had to say, what their needs were, what they would like the county to do with the funds. That included small businesses, large businesses, healthcare providers, nonprofits, things of that nature. And then we did focus groups with 78 community leaders. So again, listening. That is a predominant focus of ARPA is to listen to the needs of the community and to then take that information and move forward. So what were the key needs that we heard from all of these listening sessions and our interviews with all those different folks? So we put them into 5 general categories: so community health, county infrastructure, economic development, public safety, and support services. And within those, you can see there are either 4 or 5 subtopics that are covered within those. So community health had the largest 5 subtopics, from the healthcare capacity to substance abuse. Mental health was a big one, public health disparities. Then county infrastructure, so stormwater, obviously an issue, county facilities, transportation, and broadband digital equity. I will note for transportation that is not covered by ARPA, although obviously the infrastructure bill that was recently passed does have a lot of interest, mostly focused on transportation. So that will be something that can't be covered by ARPA, but it is obviously a very important need of the county and something that has been brought forth by lots of the stakeholders. Economic development, so workforce development, big issue. Helping small and minority-owned businesses. Employee retention has been a big issue for a lot of the businesses in the county, as well as for the government itself. And then hospitality and tourism, helping that sector is very important. Public safety, we talked a lot of folks about court backlog, hiring, retention, staffing within the public safety sector, just first response, making sure adequate resources there, and then mental health for response related to kind of first responders and mental health issues associated with that. And then lastly, support services, so rental and mortgage assistance, homelessness, food security, and then affordable housing. So these were, again, all the categories that came to the forefront after all our discussions with all the various individuals. So before we move on to the allocation, I think one thing we want to talk about a little bit is about investment principles. So this will come more into play when you actually select projects, but I think it's very important for everyone to understand. So ARPA requires certain investment principles. One is equity, very focused on equitable spending, Transparency, another big one, making sure that the money is spent in a way that everyone has visibility into how that money is being spent. And then engagement, which is what I just talked about, so engaging with the public to make sure that we as the county have a good understanding of what the needs are. So those are basically required by ARPA, so those are always at the forefront. And then through this process, we've talked to a lot of individuals, and what other thoughts do we have around investing? So the three that came to the forefront for the county were financial continuity. So that is basically, as you spend money on a project, will this be something that the county will need to be fund beyond ARPA? So, is this going to raise additional needs for the county beyond ARPA? So we want to focus on projects and look at that as a key indicator. Impact. So how much impact will these projects have? Broad impact, small impact. Also, who will they impact? So a big focus of future projects will be on impact. And then leverage. I think, as you'll see around the country, a lot of governments are looking to leverage the use of these funds with third parties, so the private sector. So utilizing the private sector to pool with them to get more bang for the buck, basically. All right, so where we are today. So there's 147 million, as we talked about. 7.6 million that has been allocated to date. There is a set aside allowed for revenue replacement that is also been pulled out. So that $10 million is a set aside that the government allows for revenue replacement. And then there's the $10 million allowed for administrative set aside. So those are the items that have been already, so about 27.6 million has already been allocated or set to the side. So what that leaves is about $120 million that remains. So we have in this exercise with the county, we've chosen to recommend 90% of that be allocated initially. And there's a number of reasons for that. One is we've heard from all of you as well as from others that we want to get as much of this funds out on the street as possible, as quickly as possible to the folks who need it. So that's in the spirit of that. The 10% remaining, that reserve could be used for a number of items. That 10% could be used for a number of items. One is things change. So we saw Omicron and other variants potentially coming. Things change. You may need to use some of the funding for other needs as they come. The other item is we've talked a lot about as programs are executed. Those that are very successful, you may want to put additional funding towards. So allowing for a 10% reserve for items like that is something we've all decided to recommend. So with that, I will have the proposed draft allocations. So you see on the left side, you see all the 5 categories and all the subcategories. You can see in the columns across the top, the normal funding that comes through the normal budget cycle for each of these areas. What CARES and the emergency rental assistance have what we've spent on those categories in those areas. And then, as I mentioned, there was about $7 million of ARPA money that's been allocated already, and you can see where that was allocated. And then, so column E is a culmination of all the analysis and work we've done with the county, along with basically asking those, how would you allocate your dollars, including all of you, and where would you put your money? So you can see the categories in general, about a quarter of the money to community health, 20% to support services, another 20% to economic development, another about 20% to county infrastructure, and the remainder to public safety, about 15%. And so if you take the 120 million less the 10%, it's about 108 million left. That's the money on the right side allocated across those different categories. So where do we go from here? So next step is obviously for you all to review, finalize, vote and approve the allocations. And then we'll start to basically establish a process to gather and evaluate project ideas. So how do we take those buckets and how do we actually get the money out into the community? Make those recommendations to the board, and then you all will obviously vote on those as well, and then we'll move to implement those approved projects. And very importantly, also track the impacts, which is another very important aspect of ARPA is looking at the impacts and reporting back to the government how successful was the money that was spent. So with that is our presentation. Happy to answer questions.
Thank you, John. Thank you for walking us through all the work that's been done thus far. and giving us the results of the allocation preferences from those who are at our strategy session and with all of the commissioners. Commissioner Burrow, I know you had some questions. Do you want to go ahead and ask them now?
Yes. You said transportation is not eligible for ARPA,
Correct.
but is the digital broadband?
Yes, it is.
Okay. So, under county infrastructure, oh, that's the current budget, so nothing was, okay. Thank you.
And the broadband is also,
I
I was
think
gonna say,
I
it's also
just-
eligible under the infrastructure as well, so.
Yeah, but nothing was, oh, I see, okay. So the last column is what is being proposed to use from ARPA money for those
Correct.
categories? Okay,
Yes.
thank you.
Hi.
Hello.
Thank you for this information as well. Appreciate all the work. And as you know, a lot of conversation around stormwater has been going on, and I certainly want to do some follow-ups with some more nuanced questions. But speaking in generalities, what are some examples of how other counties have expended their allocations towards stormwater specifically, since we're calling it out specifically?
Yes. So the way the ARPA works is for stormwater, you would develop basically general programs to help alleviate stormwater issues. So it would be a master program that would then be executed across the county in the areas that require it the most. So the county would develop a program that says in this particular area, for example, we want to relieve stormwater issues. So we would work in that particular area, again, hire a contractor, do-it-yourself, however you want to do it, to utilize that money to execute on that particular area and establish kind of a broad overarching plan to that area. So it's not specific to like individuals or things like that, but it's more, again, a plan to alleviate a stormwater issue in a particular location by hiring somebody to kind of execute on that plan overall.
Thank you. And that's kind of that's been the general application of it. Okay.
Yep.
Commissioner Sheffield?
Thank you. It's good to see you again.
Yes. Same.
I have a question regarding the mental health response. And is there a potential overlap between the mental health response and public safety and community health, mental health category? And what do you perceive those overlapping services to be?
So the mental health on the public safety side, that is, working with our first responders to handle issues with mental health related calls as they occur. We know the county has actually already done a lot of work around that and is at the forefront of that here in Georgia. And so that is additional resources to help first responders deal with mental health crisis issues as they go out in the field and deal with calls. Mental health itself under public safety is just more mental health challenges across. So I think there is a link, and obviously the more money you spend kind of dealing with mental health issues up front, the less issues you likely will see, or first responders will likely see as a result of the efforts on part one. So there is a link, but it's really targeting two different aspects of mental health.
Right. But I was just curious if there was a perceived overlap of services between the two.
I don't think so. Yeah, I think we would have to be obviously carefully
distinctive.
focus on the projects and make sure we don't overlap.
Okay. Thank you.
Sure.
If I could address something more specific to your question. So as it relates to the public health response, you may recall Director Kreider, who unfortunately is not here today. I think he's off at an accreditation meeting, but he mentioned that we have a couple of teams that are already working with some of our nonprofit organizations in that space. What he is looking to do is to add a few more teams that will be able to specifically address calls that 911 receives, for example. And one of those would be to put a mental health professional within the 911 center. And so when a call actually comes in, there's a mental health or a couple of them within the 911 center who can help the 911 operators determine whether or not we need to dispatch someone with police and fire or whatever the case may be to go to the scene to kind of help diffuse a situation. whereas some of the other mental health requirements may be more program-based. This is more response-based, and right now we don't necessarily have someone in the 911 center when a call comes in that they could actually listen to that person, talk to them, and try to diffuse the situation before it becomes an unfortunate incident with an officer or something like that. So that's one area of the response team that we're working with our mental health providers to flesh that out. Does that clarify a little bit? Okay.
Any other questions, Commissioner? Okay. Commissioner Gambrill? Mhm.
I know this was kind of touched on when I had my one-on-one, and you stated that the state received the money and then the counties received the money. Has any of this money been allocated to the cities within the county, or is that something that we might have to potentially look at doing with part of the funds?
The cities, yes, some was given to cities, not the cities as they are today that are being talked about here in Cobb County, because they were not established cities prior. So no, they have gotten maybe a few dollars here and there, but no, they did not receive ARPA directly.
Okay. And I believe we do have a couple of cities that have received direct allocations
Yes.
because of their population size.
Yeah, and they were established cities, yes.
Yes, and then the others would receive funding through the state as other cities below that population threshold.
Yeah, or through the county that they sit
Or
in.
through the, okay.
Yeah.
Okay. I know my response to, I'm sorry, Commissioner, do you have any follow-up questions?
I was just going to follow up. You said, or through the county to which they're within. So if we have cities that have needs that have not gotten funds through the state, do they know that they should be requesting those funds through the county, through our ARPA funds? And I guess, did we do one-on-ones with our 6 cities, the existing 6 cities, to have that discussion?
We did not have discussions with those 6 cities at this point. We have not. But they, in other words, they, as being part of the county, they would have been part of the county's receipt of those funds, and their expectation would be to receive those services from the county if they did not themselves get any money directly from the federal government. They could also go to the state, just like this county could go to the state and ask for additional funds as well, or team with the state. A lot of counties are teaming with the states. But at this point, those cities have not received anything directly.
Okay.
For clarification, except the ones that had the higher populations?
Yeah, what were I was going to ask, what were the? 50,000? And over. 50,000 and over were which other, do we have the cities handy? Which ones?
Marietta and,
Smyrna and Marietta have already received funding.
I'm sorry, if you can help us come to the mic.
Yeah.
Thank you. And if you can just state who you're with, because we have people watching who may not.
Sure, I'm
No,
Stephanie
thank you.
Chang, also with Deloitte, working with John. Just to help to clarify that point, so municipalities that already existed at the time Cobb County received its funding already have been accounted for. So those with populations over 50,000 have received funding directly from Treasury. Here in Cobb County, that applies to Marietta and to Smyrna. For those municipalities that have populations of less than 50,000, they are eligible to receive funding, but through the state. And so the state's allocation already has that considered and accounted for. We don't know if Cobb's smaller municipalities have made that request, but those funds are available for them at the state level.
Thank you for clarifying that, Stephanie.
Stephanie, does the same apply to the school systems within Cobb? Do they get their money directly from the state, or would they
No,
if they apply?
Yeah, they got, I was going to say, the school system here got their money directly from Treasury. So,
Okay.
So
Marietta City too, or just Cobb?
Yeah, they all got, I believe, through Treasury. I know county itself got their money directly from
Okay,
Treasury.
thanks.
Okay, I know after you gave your presentation, my response was a bit anticlimactic based off of the volume of work and the extensiveness of the work that you've done, because we've been in touch with each other during this process. But I can't tell you just how impressive a job you have done and how significant a work the county has done in partnering with you. You know, the most similar experience we have of receiving these type of funds is through the CARES Act allocation that we've received. And we had such a short window of time to spend down those funds, and we were in the midst of the throes of a pandemic. We were not as systematic. But here, you've had the ability to poll many members of our population. Up to 3,000 have been touched to provide feedback, and you came up with pretty extensive and specific categories of where we can help Cobb County, not just looking at how we can respond to this pandemic, but also be strategically set up for success beyond the pandemic. And so I personally want to thank you, thank Deloitte, thank all the commissioners for your willingness to go down this path. I know I've spoken to other county leaders who interests have been piqued in learning about what we're doing. And I think this could be a model should this once-in-a-lifetime opportunity ever come up twice. But just thank you for all of the work and helping the county sift through what is a significant opportunity, but also a challenge when you look at all the money that we have and how many needs and opportunities that we have. And I certainly feel a lot more confident in how we move forward in paring down the funds to specific programs and outreach initiatives to the community. With that said, there is a path forward, and there was a slide that showed not only where we are in this process, but what could be next steps. And I'm hoping someone can help talk to us about what the next steps could be in taking what was presented here today to actual programs and initiatives here in the county.
Up to you.
While you're coming up, Jimmy, Commissioner Burrow has a question.
Yes. For moving forward, will y'all still be working with us for recommendations or staff is?
Yes.
You
We
will?
are, yeah, we're here.
Okay. Because I know in some of our, at least in my one-on-one interview, we talked, and I think you touched on it some today, as far as using the ARPA funds as one-time money and sustainability for projects. You know, if we start with something, how are we going to finish it when this
Right, exactly.
money ends? Which would tie into our budget, of course, but I think things like that we've got to consider too, and any recommendations that y'all might have for
Yeah, no,
that and
absolutely.
staff.
Yep, absolutely. We want to vet, each individual project to make sure it aligns with all your thinking in terms of its benefits to the citizens, but also that financial continuity issue.
Right.
And as I mentioned, the leverage issue as well. Can we leverage? So we will be here to support that as well.
Great.
Commissioners, the next step will be to actually get a formal approval on the allocation, on the investment strategy.
Okay.
I guess we can use the next week or so to get input from the commissioners to make sure that everyone is in agreement with the amounts as it's laid out, the percentages as they're laid out.
Okay.
And then bring it back to the board for a vote at one of the meetings in April, whichever. If it's a smooth process, then we might can do it the first meeting. If not, we can do it the second meeting. Once we have a totally approved allocation, then we will actually start the process of setting up the project approvals. Now, if you look at the different categories, you've got community health, support services, economic development. Those three, and we've had this conversation with the Deloitte folks several times, those three will probably go into some sort of a public input process as far as projects. When you get down to county infrastructure and public safety, those projects will probably be vetted through county departments into the same approval process, but we won't necessarily take project submittals from the public on those because those are more internal.
Okay.
But then on, like I said, on the economic development, support services, and community health, and y'all keep me honest whenever I go straight. Those would, you may have some nonprofits out there that are doing a tremendous job in a certain area that fits into our allocation, and maybe all we need to do is plus that program up. However, there may be a new program that we want to push out through another source that would go through a similar process, but a little bit different. Deloitte is going to help us set that process up as far as review committees for each one of those, and then they would all come back to you for approval. So we've not found that magic number yet, like if we want to bring back 2 or 3 at a time for you to look at, or 1 at a time, or whether it's 10 at a time, but we'll work through that process, and so we don't tax you too hard with all the different projects.
Sounds good. I mean, the way that this has been presented up to this point, like a very fair process, open engagement, and just hoping that that continues, because the devil starts to creep itself through those details, and just want to make sure that that's carried through, particularly in how we potentially get projects from the public and weigh those partnership opportunities with the county or other entities.
And one thing that John mentioned a little while ago that I think he was being too modest, the transparency module of this is going to be very robust. It is going to be where any citizen in Cobb County can go on our website and see where every dollar has been spent.
Excellent.
Not only is it good in that arena, but also when the Treasury auditors do come knocking on the door, and they will sometime down the road, then we have all of our information in a nice little file, and we can just hand it over to them. So that's one of the great benefits of bringing a company in like Deloitte to help us out with this process.
Excellent. Great. Commissioners, yes, go ahead, Commissioner.
So these allocations on this page equal the total 147 million?
They equal 108, so it's the 120 that's left, and then 90% of it. So 90% of 120 is 108. So in other words, of the 147, 27's already been allocated for other purposes. So 7 was spent. 10 million is used for administrative fees and things of that nature, and another 10 million is a revenue replacement amount that you can use as you wish as well. So it's the 120 that's left over, and again, 90% of it. So you still would have a 10% bucket, $12 million left over. So there is money left over for other purposes, other uses.
Well, but my question is, we were allocated half of the 147. The other half is coming in May and has to come back for approval, I thought. But do these numbers total the full amount?
Yeah, they're the full amount.
Or just the 74
No,
million?
they're the full amount. They're the
Okay.
full amount. Yep.
So, okay.
Yes. No, it takes into account that process still has to happen, right?
Yeah, and I don't want to put any negative energy in the atmosphere, but, we know what we have today. All right, and so I know we're planning for the full installment of funds. Anyone listening in the federal space, we are looking forward to the allocation of the full 147 million. Commissioners, do you have any more comments or questions? We're good. Thank you so much for your time here today. Jimmy, we look forward to working with you to finalize what that allocation is going to look like and bring that back at a later Board of Commissioners meeting. And for our stakeholders who are here in the audience, thank you for working with us during this time, participating in our stakeholder workshop, and just continuing to serve the community as we determine how to spend these dollars. Just because we haven't made our allocation doesn't mean that there isn't a current need that needs to be satisfied, and many of you are standing in the gap as we wait for this. And I just want to thank you personally, and hopefully we'll be able to work together once we determine our path forward with these funds.
Thank you.
Thank you. With that, I believe our work session is adjourned. Thank you. We'll be back here tonight at 7 p.m. for our Board of Commissioners meeting.